Welcome back to Chronicle. Pharmacies and clinics in Iowa say they're seeing an increase in people using test and treat services. They say people commonly come in to get flu and COVID vaccines. Our sister station spoke with pharmacists in the Des Moines area that say they offer more than just those vaccines. People who stop by can get tested for the flu, COVID, strep throat, ear infections, UTIs, and pink eye all in one visit. They say tests cost around $60 and keep people out of the ER. And joining me now is infectious disease physician Dr. Renuga Vivekanandan from CHI Health. Dr. Vivekanandan, thank you so much for your time.
Thank you for having me.
Yes, we talked to you a lot, so let's start with this. What is driving the flu surge?
I think it's, one of the big areas is because H3N2, the influenza A, as you have heard. I know Dr. Hughes has talked about it as well. And on top of that, I think with the vaccine misinformation a little bit, I think the vaccine rates have gone down as well. And on top of that, the special clade, it's kind of evading the immune system a little bit. So more people are getting ill and they're spreading it more. So I think there's multifactorial, many reasons that it's kind of spreading right now.
What symptoms are providers seeing the most?
Fevers, chills, body aches, and cough, runny nose are the main symptoms that we are seeing currently.
And say an unvaccinated person changes their mind, they decide they want to get the flu shot after getting the flu. Is there any benefit there?
Great question. So currently, as you know, the influenza A is the one circulating, but in the vaccine, you get influenza B as well, protection. So talking to your primary care provider and really discussing, I did get the influenza infection. Is it still beneficial to get the vaccine? In some circumstances, if you're immunocompromised or elderly, high risk, your primary care provider might recommend that.
Now, how do you know when you can treat at home versus, going to seek medical help?
I think, keeping an eye on your symptoms, fevers, chills, are you able to keep fluids down? Are you able to eat? But the big concern is also, how are you breathing? Are you able to breathe okay? A lot of times when you get influenza, you have difficulty breathing when it becomes severe. And one of the things that it's really important to know is when you get influenza virus, you could actually get bacterial pneumonia on top in your lungs. That, with strep infection and staph infection. So that's when people get really sick. And as you heard, there have been multiple deaths around the US, about 9,000 adults, 32 children. So that can really affect your lungs. I know, it's really sad. So that's why it's really important, if you can't breathe, if your symptoms are not getting better, to seek medical attention immediately.
And we hear that it's important to seek care early, since antivirals work best when started within 48 hours of developing symptoms. Can you tell us why that is?
So earlier you take antivirals like Tamiflu, for example, it will start working on the virus sooner. So instead of the virus replicating and making more copies, it's able to stop the replications of the virus. So earlier you take, the better it is and the less effect it has in your lung. So definitely within that 48-hour window, it's really important to get checked and treated, especially if you're high risk and if you didn't get vaccinated, elderly patients, pregnant moms, if you have like cancer, immunocompromised conditions. So I really suggest getting early tests so you could get that treatment.
Are there treatments that might work better for the younger population and better for the older population?
Great question. The antiviral is really designed for all ages, so it really helps all age population. You can go get it tested at your primary care office. Now they even have those tests at, pharmacy and things that you could buy for COVID and influenza together. So you could buy over-the-counter testing if you need as well.
How has that changed the landscape, these at-home tests?
I think it has changed a lot because it immediately, many of my patients, they test, they call me, they have the symptoms, and then I could actually call on the medications. Sometimes they don't have to come in, really assessing them over the phone or televisit. So it has really changed testing and giving that care sooner than later.
I want to ask you what I asked Dr. Hughes when we spoke earlier. Is there an aspect of this that concerns you the most?
The concerning thing for me is how large of cases we have had this year. and how we're still in the peak area. We haven't really peaked. If you look at the cases, so we're still trending up. So I think it's really important to get vaccinated. It's lots of time still. You know, I strongly recommend getting vaccinated throughout the springtime until the cases come down. So that's why I encourage everybody to get vaccinated so we could kind of bring the peak down. Because during Christmas time, test positivity was about 25%.
We know vaccinations are one thing. What else can families do to protect themselves right now?
Yes, definitely. Hand hygiene, washing your hands are really important. You know, I have little kids, you know, it's really important when they're ill, I keep them home until they get better so that I don't expose others. So really, if you're ill, staying home so we protect others are important too. And particularly if you have, you know, at your home, elderly family members, you know, family members with severe health disease or conditions, like protecting them. So vaccine, staying home when you're ill, really good hand hygiene. These can pick up germs and spread it, so really washing our hands really well.
You know, you have kids, you talk
Yes.
about, you know, teaching them to wash their hands. What are your
Yes.
tips for parents who are trying to get their little ones to get into that practice?
Just like brushing the teeth, you know, telling them to like sing a song, wash your hands all around, put the soap, just like teaching them how to do proper hand washing is really important. And of course, if you have hand gel, you know, that's okay as well.
Making it fun.
Exactly. And telling them healthy hands protects you and protects others.
What should people watch for when it comes to worsening symptoms?
Worsening symptoms, if the fevers are not going down, sometimes what happens is you have initial fever, it goes down, and then the fever comes back again. That's a signal you might have a bacterial infection on top, or your viral infection is not getting better. So really keeping an eye on fevers. How fast are you breathing? Typically we breathe about 16 times a minute, but if you're breathing 25, 30, really breathing heavily, those are all concerning things. So how are you breathing? Are you feeling short of breath? Those are all things to keep an eye on.
We know the elderly and babies are very vulnerable. Who else is more at risk for those worsening symptoms?
Elderly, babies, patients with a lot of immunocompromising conditions. So if you have cancer, you're on chemotherapy, or if you have diabetes, you know, all those chronic conditions can really put you at high risk. And also pregnant moms. So really, many different a population of us are in high risk, so really getting vaccine is important.
When it comes to the flu, influenza A, influenza B, what is your message to viewers right now?
It doesn't really matter if it's A or B. They all cause very similar symptoms, but the most important thing is what can we do to prevent the infection? So really, it's not too late to get vaccination for influenza. So I strongly recommend getting influenza vaccination. And you know, if viewers have questions or concerns, it's really important to sit down and talk to your primary care physician, advanced practice provider, get the knowledge that you need, get your questions answered, but also you know, get that vaccine because it does really protect you.
Is there a most commonly asked question that you really want to answer right now?
Most commonly answered question is, you know, when I get the vaccine, I get the flu right after. I'm sure you've heard that. Sometimes when you get vaccine, you have a little bit of an immune reaction, like a little bit of fevers, you kind of feel a little tired. That's actually your body's way of producing those good antibodies. So it's not that the vaccine is giving you the flu, it's just your body is preparing you and giving you those good antibodies to protect you against the infection. So that's one of the big ones I always get asked. Yeah.
You know, as someone that works in this field, what is the most rewarding aspect for you?
Prevention. When it comes to infection, prevention is so important because what really makes me sad is that influenza can really cause severe bacterial infection, and that's when patients get into the hospital, you know, they're there for a long time. So preventing an infection is the most important thing so that we don't have to deal with the complications for our patients in our community.
How do you feel about the latest vaccine right now?
Every year, you know, you might have really good match or moderate match. We're in the moderate match area, but what is really important is when you get influenza vaccine, moderate or high, you're stimulating your bodies to produce those antibodies. I call it like, you know, your body's ready to fight. So it's still important. The vaccine is very effective, still important to get it, because once you get it, even if you get the infection, you will have a less severe infection compared to a severe infection.
Dr. Vivekananda,
Yeah.
thank you for your time. Thank you for taking all of those questions. We greatly appreciate it.
Thank you so much for having me.
Absolutely. Well, coming up, an Omaha woman dies from the flu. We're with her grieving family, their message to all of you. First, a reminder that your comments are an important part of this show. If you want to be heard, email your comments to news@ketv.com. Remember, we love hearing from you. We'll be right back.